Welcome to the University of Michigan Adult Bariatric Surgery Program. We offer a comprehensive and personalized weight loss surgery program designed to help you reach your goals. Success starts by learning more about obesity, understanding the risks and benefits of surgery, and committing to lifelong habits to improve your overall health. Let's start with the facts. Obesity is really common in the United States, and about 1/3 of people in Michigan are living with obesity today. As a result, many people are suffering from diseases related to being obese. These include diabetes, heart disease, high cholesterol, sleep apnea, arthritis, fatty liver disease, infertility, and even certain cancers. It's clear that when you lose weight, you can improve your overall health, reduce your dependence on expensive prescription medication, and even extend your life. In fact, the National Institutes of Health recognizes that bariatric surgery is the most effective treatment for morbid obesity. We performed two bariatric procedures at the University of Michigan, a gastric bypass and the sleeve gastrectomy. The gastric bypass is also known as the Roux-en-Y gastric bypass, and the sleeve gastrectomy is also known as the vertical sleeve gastrectomy. Both of these procedures are performed laparoscopically, which means we make small incisions along the abdominal wall and use a camera and instruments to perform the operation. It is very similar to gallbladder surgery and removing your appendix. Using these advanced techniques results in shorter hospitalizations, quicker recovery, and less complications when compared to procedures that were performed with a large incision. If you've had previous surgery, like a C-section, hysterectomy, or gallbladder removal, it's important to know that in many cases bariatric surgery can still be performed laparoscopically. So let's discuss each operation in a little bit more detail. The first type of bariatric procedure we perform is the sleeve gastrectomy. In this operation, we use special surgical staplers to divide 80 to 85% of the stomach and remove it completely. The operation is done under general anesthesia and usually takes about 1 to 2 hours. The hospitalization is 2 to 3 days typically, and most people lose about 55 to 65% of their excess body weight. Depending on how much you weigh, this is usually around 60 to 100 pounds. It's important to know that weight loss is maximized at 1 year after the procedure is performed. Overall complications are low and similar to that of gallbladder surgery. Major complications, such as leak or bleeding along the area that is stapled, is also low. Remember that this operation is not reversible since the stomach is removed completely from the abdomen. It is also important to know that in some patients, this operation can result in heartburn. This animated video will provide you with an opportunity to see how the procedure is performed and how food will travel through the stomach after a portion of it is removed. The second type of bariatric procedure we perform is the gastric bypass. This operation is more involved, but is still performed laparoscopically. With this procedure, the stomach is divided using surgical staplers and separated from the remaining stomach, thus creating a small gastric pouch. This is about the size of an egg. Next, the small intestine is divided midway down the intestinal tract and then connected to the stomach. So when you eat food, it goes straight into the small intestine and thus bypasses the stomach and first part of your intestinal tract. Bile, pancreatic, and gastric juices are still being made and they continue to pass through the intestinal tract as before. This operation is also performed under general anesthesia, but the operation is longer, usually about 2 to 3 hours. Most people lose about 65% to 75% of their excess body weight, or about 100 to 150 pounds, depending on how much they weigh before surgery. As with the sleeve gastrectomy, maximal weight loss happens at 1 year. When compared to sleeve gastrectomy, gastric bypass has a higher complication rate, but overall major complications are still low. One important difference to remember is that after gastric bypass surgery, some people can develop an ulcer at the connection between the stomach and the small intestine. The risk is usually low, less than 5%, but it's most common in people who decide to smoke after surgery or those who take non-steroidal anti-inflammatory medication like Motrin, Advil, aspirin, or ibuprofen. So after gastric bypass, you can never take these medications again. Other issues that are unique to gastric bypass surgery is dumping syndrome, which results in sweating, diarrhea, and gastrointestinal discomfort as a result of eating certain foods that are high in sugar or fat. This often improves with a change in diet. Finally, in rare instances, some people can develop an internal hernia after surgery that causes a serious blockage of the intestine. This usually requires surgery to correct. Together with diet and exercise, bariatric surgery is extremely effective in achieving weight loss. However, it is not exactly clear why it works much better than diet and exercise alone. With a smaller stomach, many people do eat less, and there may be some decreased absorption of some food, but recent research shows that these operations fundamentally change your body's regulation for gaining and losing weight. In many cases, surgery changes tastes and cravings for certain foods, and even changes how you process these foods. For some, the operation can cure diabetes even before the weight loss is achieved. However, in a small number of people, bariatric surgery does not result in successful weight loss, and in other cases, some experience significant weight regain. It is difficult to know why this happens exactly, but it often has to do with our food choices, our exercise tolerance, as well as our genetics, gender, and age. For others, taking certain medications or being ill for other reasons may prevent the body from achieving maximal weight loss. After surgery, most people stay in the hospital for 2 to 3 days and are then discharged to home. The main restriction is to avoid heavy lifting. However, you can resume many of your usual activities. Since the incisions are closed with absorbable suture and covered with a waterproof dressing, you may shower. You can also walk up steps and stairs, and we encourage you to walk at least 30 to 45 minutes a day after surgery. Driving is restricted so long as you're taking narcotic medications. The first follow-up visit is 2 weeks after surgery. During that visit, your surgeon and your dietitian will see you in clinic. You will follow up in clinic 2 months after surgery as well, and again be seen by your surgeon and dietitian. We usually get lab tests during that visit as well. At the 6-month and yearly visit, you will be seen by our physicians in the metabolic and endocrine clinic at Domino's Farms. Using our multidisciplinary approach, these doctors will work with you to make sure you achieve your long-term weight loss goals. The diet after bariatric surgery is very specific and one of the most important parts to being successful. Before surgery, you will need to be on a calorie-restricted, high-protein diet for 2 or 4 weeks. After surgery, your diet will progress from liquids to purees to soft foods and ultimately to solid foods. Our goal is for you to eat 70 grams of protein each day as well as drink 64 fluid ounces. This is not a simple task, and after surgery, sweets and carbonated beverages are not tolerated at all. It is also important to know that after bariatric surgery, vitamins are not absorbed in the same way, so it's important to take supplements. As you can see, the vitamin supplementation includes a multivitamin, vitamin B12, and calcium. If you have a gastric bypass, you will need to take more supplements. So what is the best procedure for you? Well, in trying to answer this question, you must always balance the risks of complications with surgery with the benefits of weight loss. In order to help with this decision, we use a special calculator that gives you the results of surgery in other people who are just like you. So each person that goes through our program will get a personalized risk-benefit profile that gives us the best guide for which surgery is the safest and most beneficial. So before considering bariatric surgery, it is important to think about your goals. In many cases, the amount of weight loss is not as important as the reduction of comorbid conditions, improved mobility, and cutting out prescription medication. Regardless of procedure, undergoing bariatric surgery is a life-changing experience that requires a careful consideration of your overall health as well as understanding of the non-surgical alternatives. If you are struggling to lose weight after multiple attempts, are over the age of 18, and are willing to make lifelong commitment to your health, bariatric surgery may be for you. In order to be a candidate for surgery, you'll need to first calculate your body mass index, or BMI. This can be done from our website calculator. You're a candidate for surgery if your BMI is over 40, or If your BMI is over 35 and you have certain weight-related illnesses like diabetes or high blood pressure. You will also need to be able to tolerate general anesthesia. You must be able to walk to your clinic visits and also commit to a daily exercise program. Finally, you will also need to commit to lifelong dietary changes and stop using any form of tobacco product, as we are a substance-free program. The road to surgery is not always simple, but we're here to help. It starts with watching this video, as it gives you the necessary information to proceed. After careful consideration, the next step is to schedule a medical and dietary evaluation. Once these are complete, you'll need to schedule a psychological evaluation next. Since we want to provide a comprehensive approach to your care, each one of these evaluations is mandatory. After these initial evaluations, our multidisciplinary review committee will assess your candidacy for surgery, and we may require additional tasks for you to complete. These often include cardiac clearance, labs, endoscopy, or other imaging studies. You will receive a personalized letter that will include your risk-benefit profile detailing your estimated weight at 1 year after surgery, as well as your risk for complications. Finally, this letter will also include additional requirements and some recommendations that will be presented in a checklist format. We will also ask you to attend 2 support group meetings so that you can meet other people that have undergone surgery. This is really important to fully understand the lifestyle changes necessary after surgery. For some people, your insurance carrier may also require that you undergo 3, 6, or 12 months of medically supervised weight loss documentation before undergoing surgery. Once all of these requirements have been completed, you will undergo a separate nutrition class that will detail the pre- and post-operative diet. You'll also meet with your surgeon in clinic so that you may ask them specific questions about your care. Finally, you'll undergo a preoperative history and physical exam in which our anesthesiologist will make important recommendations about which medications you'll need the night before surgery. Insurance coverage for bariatric surgery varies, so it is important that you contact your own provider to get the specific details. In order to help, we have provided a list of questions online that you can use when you contact your insurance carrier. It is also important to document medically supervised weight loss appropriately. So, we've provided a sample form online in order to help you do this. Ultimately, we want you to succeed. And in order to ensure your success, we offer a comprehensive approach with a multidisciplinary team of experts. Our experienced surgeons are trained in bariatric procedures and are always available for emergencies, providing coverage 24 hours a day and 7 days a week. We also offer a secure online site with resources at your fingertips, as well as a weight loss conditioning program that is designed for your needs in mind. Finally, we also offer a specialized nutrition program that explores core reasons for overeating and emotional eating. Our clinic is located at Domino's Farms, and surgery is performed at the University Hospital. If you're interested in taking the next steps towards undergoing bariatric surgery, please answer the quiz questions below and provide us with contact information so that we may schedule your first evaluation. If you'd like to learn more, you may attend an informational meeting. This is a 2-hour group session that allows you to meet one of the surgeons as well as the dietitians. You'll be given the opportunity to ask general questions about surgery as well as our program. Thanks for listening, and we look forward to helping you lose weight and improve your health.